Early 2020, the COVID-19 pandemic brings the world to a grinding halt. Lockdown follows lockdown as nations attempt to contain the spread of the virus. Across the world, the scientific communities speed up their processes and try to understand more about this new virus. In India, all this is accompanied by a realization that we need to look within for solutions and coping mechanisms with this pandemic. The Indian scientific community gears up to make sure we have enough equipment to cope with the rising number of cases. Research organizations step up to find solutions to manage this disease. How does India manage? How do we enhance infrastructure and systems to become truly Aatmanirbhar? In 2019, when the COVID-19 virus first surfaced in Wuhan, China, it felt like a distant threat. And then it started traveling through Asia, Europe, North America. The first case in India comes to light on the 30th of January 2020, when a few students returned from Wuhan to Kerala. As the numbers start to rise, India starts assessing the situation. Specialist medical teams are assembled to understand the virus better, work out ways to contain it, and to evaluate if we had all the essential items that the country needs to fight the virus. One of the worrying situations in the early stages of the outbreak was frontline healthcare professionals contracting the COVID-19 infection because of a lack of adequate protective gear. According to WHO standards, the best way to protect health workers and other agencies battling COVID is a PPE kit. PPE stands for Personal Protective Equipment. This comprises of goggles, face shield, mask, gloves, coverall, gowns, with or without aprons, head cover and shoe cover. These are designed to safeguard the health of workers by minimizing the exposure to a biological agent. In India, the government's national guidelines for infection prevention and control in healthcare facilities furnished an elaborate list of PPEs to use when tending to patients. However, when the pandemic hit India, not a single PPE kit was being manufactured in the country. They were all being imported, and the actual number of kits available across the country were only about 60 to 70,000. It was one thing to decide that Aatmanirbhar Bharat was our goal. It was quite another to work out the knowledge and expertise needed to make these kits. Various institutions started coming up with designs. The DRDO, for example, suggested use of a special adhesive which finds its applications in submarines to make full-body suits at a low cost and at a scalable level. They shared this technology with other companies. With the appeal made to step up local production, numerous private companies also volunteered. One of the first companies to pitch in was Delhi-based Science Synergy.
बहुत लोगों ने उस टाइम पे रिस्पॉन्ड नहीं करा था. हमारी कंपनी ने उसी टाइम
A lot of people did not respond, and we were one of the firsts to respond. We showed our products to the director of textiles. They realized that we had the potential to make these suits.
में वो है कि हम वो प्रोडक्ट्स बना के ऑफर कर सकते हैं.
However, on 24th March 2020, India imposed an unprecedented lockdown. When everything was shut down, the team at Science Synergy were not sure how the factory would operate. Both labor and access to raw materials became a challenge in this environment.
रॉ मटेरियल्स के लिए स्पेशल
trucks were deputed to bring in the raw material. They helped in the shifting of these materials from places like Himachal Pradesh and were classified under the emergency services, making it easy for us to access it. We brought labor and supervisors who were already skilled, as there was no time for skill training. The government machinery supported us very efficiently. All these are done within 2-3 days.
Emergency environment.
With the systems in place, the manufacturing process started. PPE is made using a material called polypropylene, which is used for many medical products. The material is laminated with special polymers and is covered by a monolithic microporous membrane. This membrane will play a role in blocking the virus. No virus can enter, and yet it is breathable and comfortable for the user. Once the fabric comes to the warehouse, it is cut for universal sizes. The material is laid out and each portion of the PPE kit is marked out precisely: the head cover, the body cover, the leg cover and the shoe cover. The cutting is done using a special machine. The pieces are checked and then sent to the production bay. Different teams make different portions of the suit. Then one team joins them all together. This is done using an overlocking machine, a high-speed machine which has fine, precision needles. This is because the virus can penetrate through larger stitching holes as well. Then there is a process of seam sealing to cover all the places where the thread is visible. Hot air seam sealing machines use air to seal the thread using a special adhesive. The seal ensures that no particle is able to enter the suit. The most critical portion of the PPE is the chest area. This is specially designed with a double storm flap for higher protection. The inspection of the final goods is critical. Every unit is checked properly in a sterile environment. They are labeled clearly with information on the life cycle of each piece and how it should be handled. The PPE is then packed and ready for dispatch.
देखिए, जो हमको सबसे पहले HLL ने जो ऑर्डर दिया था वो था करीब 1.5 लाख पीसेस का, 1.5 लाख PPE का.
First order was of 1.5 lakh pieces, but we had done the planning for only 40-50 kits. When the government told us that the figures could increase to crores, we booked 3-4 factories that were providing the raw material by giving advances. First day, we made 428 pieces, but in next 3 days, we scaled up to 3,000 per day, 5,000 and then 12,000 per day capacity to HLL alone. We did overtime and didn't sleep for days together.
लेकिन उसको हमने सडनली अगले 4 दिनों में 3,000 पर डे, 5,000 पर डे और फिर 12,000 पर डे की कैपेसिटी पे हम ले आए. तो every day to HLL alone, we were giving 12,000 pieces per day.
The PPE kits reached the frontline workers who were now able to battle the pandemic. Across the nation, numerous other factories also started making PPE kits. Between March and September, India became the second largest producer of PPE kits in the world. By June, we had permission to even export this.
आत्मनिर्भर बनने के लिए
We need to constantly challenge ourselves to surpass our and international standards so that we can move towards a self-reliant India faster. Government and many private players are now involved in helping the technical textile industry and making things easy for them. They are now promoting the sector, which is right step towards self-reliance.
बहुत अच्छी गति से उसको अचीव कर पाए.
This was just one step in our battle against COVID. But as India opened up and people started going back to work, back to the markets, the need for sanitization raised its head. Keep watching to see how we came up with innovative solutions to sanitize public spaces.
India Science Channel was launched in the year 2019 by the Department of Science and Technology, Government of India. The internet-based dedicated science web channel is being implemented and managed by Vigyan Prasar, committed towards science communication. The channel features science documentaries, discussions on current topics, interviews and different programs covering the entire landscape of science and technology to make science popular among the masses.
India Science is a flagship project of Vigyan Prasar. And over a year and a half, we have produced more than 1,200 videos of different sizes, lengths, and are from different genre and for different domains for the people of the country. We've taken, we have spoken, we've gotten, we've dived deep into the realms of different domains of science and technology, and we have gotten news, stories, films, videos, in almost every format that you can think of. OTT, for that matter, is a great platform that helps anybody to look for any news, any item, any video, any documentary at any point in time. All you need to do is to subscribe a channel for it.
One can also download India Science mobile app from Google Play Store or Apple Store to view this channel.
With no cure or vaccine available yet for the COVID-19 virus, prevention of the disease became paramount. Hand-washing hygiene became one of the most important measures to prevent infection. The other option was to use hand sanitizers. With this understanding, the demand for sanitizers in March 2020 increased to such a point that shops ran out. People started stocking up. There was an acute shortage. How can a sanitizer or soap battle this virus so effectively? The virus that causes COVID-19 is made of a molecule called RNA, which is encased in a fatty lipid bilayer. Soap molecules can break apart the lipid bilayer of the virus, destroying the genome. Remember, hands should also be washed for 20 seconds to eliminate the virus. Sanitizers need to have more than 60% of alcohol content to be effective. Like soap, the alcohol damages the lipid layer that envelops the novel coronavirus. With this increased use of sanitizers, the government included sanitizers in the essential commodities list. This meant the cost needed to be kept accessible to every citizen in the country. As a result of this, local manufacturers flooded the market with alcohol-based sanitizers to help contain the spread of the virus in the country. However, as the nation started opening up and people headed back to work, to markets and malls, the sanitization of public spaces became a challenge. Persapien Innovation is a Delhi-based company focusing on health innovation. The founders, alumni from IIT and Stanford, started working on a sanitizer that would sanitize larger spaces.
Had a lot of brainstorming sessions and eventually came to a point where we could figure out a way through which we could kill the virus very safely.
In our domain, where we are developing devices and new technologies, we thought this problem can also be tackled by preventing it.
They came up with a device called AirLens minus Corona. The simplicity of the design lies in the fact that the AirLens minus Corona uses tap water rather than alcohol to sanitize. The device has a reservoir water tank where water is stored. In the other tank, the water is charged through electricity. Once the water is charged, it starts to break it into small droplets and released in the air through a fan, which then becomes mist and spreads throughout the airspace. Once these particles come in contact with viruses and bacteria, they either oxidize it or break their walls or outer coating, which inactivates or kills the virus or the bacteria.
This water does not reach or does not affect our human skin or our internal tissues because we all have a mucus layer. The water droplet comes in contact with that, it gets absorbed and it does not go inside deep tissues and does not cause that damage. Since it's just water, it loses charge in course of time.
The assembling of the device starts with the water control circuit and magnetic sensors. The circuit is connected to the power supply. The voltage reading of the circuit at the input and output terminals are checked to ensure it is working properly. The multimeter signifies the amount of voltage the circuit is connected to. Then, soldering of all the electrical connections are done to insulate them. Then the intelligent control circuit is checked. This senses the temperature and humidity in the room to ensure maximum efficiency to kill microorganisms. The red color display signifies the temperature level in the room, while the blue display signifies the humidity level in the room. The final assembly is done by putting all the sub-assemblies into the frame. Let's see how this works. Water is poured into the device and it is switched on. A swab is collected from a random surface. The swab is then fed into the ATP, adenosine triphosphate sensor. The sensor indicates the level of viral contamination of the surface. In case of contamination, the number goes above 5000 mark. The device is then allowed to run for a few minutes. The swab is again rubbed into the surface and is fed into the ATP sensor to check the level of contamination. The decrease in the reading shows that the surface is safe and has got sanitized. This proves the efficacy of the device.
And this is a equipment that is being used for any hygiene related place, like even in hospitals some people use it to check whether the hospital premises is hygienic. So they take swab sample and put it in this machine and see the reading. If reading is below 100 or is in range of 50, 100, 200, then this is pretty much clean.
It is innovative technologies like this that push India along the path to self-reliance.
If India has to become Aatmanirbhar, the technology or the new science or new technology has to be developed here, and that has to be developed as per the requirement.
Because now we believe that we can create something in this soil of India which would not only make India self-sustainable in terms of technologies like this, but we envision that this technology would spread worldwide from here, because this pandemic had been a big global crisis, and if you can solve it with a technology that has emerged from India, I think that will be one of the biggest examples of Aatmanirbharta and Aatmanirbhar Bharat.
Another solution, an innovation to prop us up through the difficult battle against the COVID pandemic. But there were so many other gaps in the system. The need for large-scale sanitizing, testing in remote locations, the need for a vaccine. Would we be able to fill all these gaps in our journey to become self-sufficient? Keep watching to find out.
India Science Channel was launched in the year 2019 by the Department of Science and Technology, Government of India. The internet-based dedicated science web channel is being implemented and managed by Vigyan Prasar, committed towards science communication. The channel features science documentaries, discussions on current topics, interviews and different programs covering the entire landscape of science and technology to make science popular among the masses.
India Science is a flagship project of Vigyan Prasar. And over a year and a half, we have produced more than 1,200 videos of different sizes, lengths, and are from different genre and for different domains for the people of the country. We've taken, we have spoken, we've gotten, we've dived deep into the realms of different domains of science and technology, and we have gotten news, stories, films, videos, in almost every format that you can think of. OTT, for that matter, is a great platform that helps anybody to look for any news, any item, any video, any documentary at any point in time. All you need to do is to subscribe a channel for it.
One can also download India Science mobile app from Google Play Store or Apple Store to view this channel.
As India tries to cope with the COVID crisis, many organizations rise to the occasion, coming up with solutions that address gaps in the system. But the pandemic was like a many-headed monster. Every time one solution was found, a new problem reared its ugly head. And so many research organizations, both public and private, adopted a multi-pronged approach, with numerous teams working on coming up with scientific innovations to different problems. One such institution was IISc Bangalore.
IISc was in a great position, being a campus which has scientists and engineers in the same campus. We had an environment to do actually deep science as well as translate that science into innovation.
One of their innovations was a drone, that could be used for sanitation. This would play a big role in disinfecting large public spaces.
When COVID-19 occurred and the lockdown was imposed by the government of India, it was imperative that we have to sanitize large spaces in the city so that the infection does not spread. But there were problems because people were not available to do this for obvious reasons, and also there are places where there is possibility of crowd and no one would like to go there, and we wanted to do it very quickly. So when we tried to put all these together, drone was the only solution that could be thought of.
The scientists worked at modifying a drone which was initially designed for spraying pesticides in farms. The design of the drone and the spraying mechanism needed to be tweaked to be more effective in a COVID scenario. The drone could carry 8 liters of disinfectant and managed to spray it at a speed 30 times faster than manual spraying. Despite the increased speed, it needed to cover a larger area. For this, a special wider nozzle was developed, which was a 7-fold improvement over the one used for pesticides. An atomizer converted the liquid into very small particles for the wider coverage. With the help of these drones, IISc has successfully carried out disinfection over 4 lakh square kilometers of public spaces, including streets and containment zones. These drones were also used to deliver medical supplies and monitor critical zones. Another innovation from the IISc labs was a low-cost ventilator. The scientists came up with a new design made from easily sourced components that could still perform all the functions of a conventional ventilator.
We basically realized that a ventilator is nothing but a fluid mechanics circuit. None of us had previously worked on any biomedical devices, but if you go to the heart of it, it is all fluid mechanics. So we quickly researched into existing ventilator technology and then brainstormed ideas and came up with a way in which we can reinvent some of the aspects related to ventilators such that we can produce a working prototype using only indigenously and easily available components.
The other gap on the ground was a lack of testing facilities. To tackle this, IISc designed a mobile testing lab that was Biosafety Level 2+ compliant and ICMR approved.
We have come up with this mobile lab solution in terms of capability to enhance the scaling up of this testing, which is one of the very prerequisite in the entire scenario of tackling and addressing the COVID-19 situation.
These mobile labs can travel to remote areas and run tests. There are 3 vans. The first van is for sample collection. Samples are collected in the form of swabs. Then the sample goes into the next van where the RNA is extracted. Then the extracted RNA is loaded on the RT-PCR instrument for analysis and reporting in the third van. These final test results can be directly uploaded on the ICMR website.
This consists of 3 labs, 3 different mobile vehicles which operate together to help in producing these test results at the point of need, where whether it is hotspots or containment zones or doorsteps. When they are deployed, wherever they are deployed, within few hours they are capable of generating the results.
These vans provide a safe environment for medical personnel to work and populations to get tested. These 3 labs can process up to 200 samples a day from collection to final RT-PCR reports. Test results are produced in 4 to 12 hours. This has helped scale up tests to about 6,000 to 9,000 tests a month. All the other scientific innovations help the situation on the ground, but the need of the hour is clearly a vaccine. research teams around the world are racing to create a workable vaccine. So are the teams at IISc. The vaccine development is still under testing phase, but the initial results are promising. Most vaccines require to be stored in freezing temperatures. Cold chain refers to the process used to maintain optimal temperature conditions during the transport, storage and handling of vaccines, starting at the manufacturer and ending with the administration of the vaccine to the client. Vaccines may be inactivated by exposure to high temperatures. However, the vaccine formulation here doesn't require low temperatures.
What we were able to show with our particular vaccine formulation is we did not need to keep it cold. So for example, we were able to show that we could even heat it to boiling point temperatures after it was freeze-dried, the freeze-dried material. And then when we cooled it down and we redissolved it in solution, the protein structure and shape were not affected.
The scientific teams have developed molecules that are being tested on mice, guinea pigs and hamsters.
We have good results so far, and so the next step is to produce this molecule in a larger scale and check the safety and the toxicity of the molecule, and then after that we have to prepare it under what is called GMP conditions with a manufacturer, because we are not obviously manufacturers, and then that has to be tested in clinical trials.
These are only a few of the innovations from this institute. This kind of concerted effort can play a big role in helping India battle the COVID pandemic. Solutions from within, indigenous science are all a big part of our journey to become self-sufficient.
Indigenous technology development, according to me, is one of the most important things any country can do for it to be self-reliant and prosperous in the long term. So all these efforts spurred on by COVID are certainly aligned along the lines of Aatmanirbhar Bharat.
And in this fashion, different pieces came together from different organizations, from innovators, from individuals. And all these bits made us stronger, more self-reliant. The journey will go on, but we have shown how Indian science can come up with solutions that could make us truly Aatmanirbhar.